Hello and welcome to another Fox 411. We got some special guests here today. We are going to talk about the North Iowa Addiction Prevention Alliance. It's through Prairie Ridge. They have an opioid treatment program that we're going to talk about here today. Obviously, an issue that has been talked about and has been around for a very long time. I have Shay Jorgensen here with me. We're going to talk to you first. You're with Prairie Ridge. And why don't we just talk about the program itself? When it got started? What's the deal going on with all of this?
Thanks for having us here to talk about it.
Yeah.
So we started our opioid treatment program back in December, and it's a program that doses people with methadone. So if somebody has a moderate to severe, particularly severe opioid use disorder, it's allowing us to give people a medication that's evidence-based to help reduce relapse, cravings, and overdose for people using opioids. And the reason that it's so important that we were able to bring it here into our community is because it's a medication that's really highly regulated. So when people first start taking it, they have to come into the clinic 6 days a week to get dosed. Prior to us opening, the nearest clinic was in Waterloo to the North Iowa area. And so having to drive, 70 plus miles round trip, we're 70 miles one way. So 140 round trip just to be able to get a dose of methadone that you have to go 6 days a week makes it really difficult for people to engage in treatment and to be able to get started on a medicine that can really change the trajectory of their life. So we were glad to be able to get through all of the processes of all the legal things we had to do to open the program locally. But now we have it available for people locally to be able to start methadone treatment right here in Mason City.
I was going to say, is it just about methadone, or does that just seem to be the biggest one right now?
So we already had other medications options available, and we still have them available. The other commonly used medication is buprenorphine, or Suboxone is the brand name for it. That's the other medication we most commonly use for treating opioid use disorder. When people are using high doses, particularly of fentanyl or uses IV heroin or high doses of other opioids, oftentimes Suboxone is an insufficient medication. It's just not strong enough for people with more severe opioid use disorders. And so this program that we opened in December is specific to methadone. And that's the medication that has another level of regulations because it is an opioid medication that we're giving to people. So this program, the opioid treatment program, is specific to methadone, but we have a variety of other options too within Prairie Ridge that treat other forms of addiction too.
Well, if it takes away pain, a lot of people can get addicted to that stuff. That's for sure. And
So tough.
it's just and this is I don't even know if it's a world problem, but definitely a national issue. And you mentioned the fentanyl and stuff, and that's the tricky one, I think, because we've heard of overdoses and everything else, and that's what's so dangerous about this. So it's great to know that you got a program. Is this a program that what do you just walk in, they get you, is it like a inpatient thing, or is it an outpatient thing, or what?
That's another great question. So when people get started on the program, it can be through our residential substance use treatment program, which is the 28-day inpatient program. So for some people, they prefer to come in and do the full 28-day stay where they're staying at Prairie Ridge. That's not required for the program. So if people are outpatient, living at home or in the community and want to start the program, they can certainly start outpatient. They do not have to do the residential program.
Okay.
And they can either schedule or they can come in through a walk-in process. We're usually able to get people seen within a day or two of when they want to be seen. And so the first step is to see either myself or a psychiatric nurse practitioner. We have Shelby Ellen Bennett. We do the evaluations, get people into the program, and then the program includes the medication management, also therapy. Therapy is a huge core part of the program so that people are also getting additional support beyond just the medication.
Mm-hmm. Is there sometimes, I'm sure that there's other addictions that are maybe tied to it as well?
You're totally correct. So for the majority of people using opioids across the country, the trend is polypharmacy, meaning that people use, not polypharmacy, polysubstance use, where people are using multiple substances.
Right.
And so oftentimes people are using other substances like methamphetamine or sometimes alcohol or benzodiazepines in addition to opioids. That said, some people have just opioid addiction as well. So both would be able to be served through this program, but this program is treating the opioid use disorder specifically.
Well, we're lucky to have a patient that went through this program. And Delane, are you still in the program, or do you still go, or when
Yeah. Yep. I am. Harry, I started out, I initially, when I went to seek help, I was in pretty bad shape, and I had to be hospitalized for about a week and a half, just because of the dangers of withdrawal and
Mhm.
them types of things. I don't know if Shay can probably tell you the complications that can happen with withdrawal, but I know for me, heart and a number of other
Oh yeah,
conditions, but
can cause all kinds of. It can spread out to a lot of
yeah,
different things.
yeah. I actually, when I had went into the hospital, I just about coded twice in the ER. So,
Wow, wow.
but
So, can I ask how long have you been in the program then?
for just about 4 months now.
4 months. Okay.
Yeah.
And what's it like?
It's good. Life is good now. It's awesome drug as far as it goes for me. It has just been amazing. I've tried some other things and it never worked, but methadone is definitely
Mhm.
a good medicine, and I think Prairie Ridge and the grace of God, and it's just life is good now.
So,
But there were
when you
many
say
complications.
when you say it got out of hand, I'm just trying to put this in perspective for people that are watching and listening or whatever. What happened? Basically, you just took too much.
Well, what would happen with me? Everyone's situation's a little different.
Sure.
I myself got kind of addictive personality anyway, but
Yep. I hear you.
right.
Yep.
But I was getting I had like 3 surgeries in like a year and a half span, and before that, I was getting painkillers. I had neck surgery, a couple hand surgeries. I got a rotor cup that's 3/4 of the way torn, but I'm just kind of living with that and just kind of taking that day by day. But the doctors, were prescribing me oxycodone, hydrocodone, all the better painkillers that take
Sure.
the pain away.
Sure.
But it gets to the point where you're taking so many of them, and the doctors, start catching on and
Mhm.
that, and then they cut you off, and for myself, I started getting them off the streets, and yeah, and I just got to the point, Harry, where it was very out of control,
Right.
and something told me, hey, you need to get help, and you need to get help now, and it had to been the good Lord,
How about
because
the?
I go ahead.
No, I'm sorry. Go ahead. Go ahead. Finish.
I just, like when something told me, yeah, you need to get help, and you need to get help now. I went into the hospital and got it, but and then to Prairie Ridge, and
Mhm.
but
How about what the impact, I guess, of what Prairie Ridge has been able to do for you? Can you talk about some of the things that
yeah.
you learned a lot? What really helped you get to this point?
Well, I guess their support. They have many other things. They help with the opiate problem. I mean, I did some counseling therapy, and I still am. But for the people out there that, let's say, may have lost everything, which I just about did, very very close to losing everything. They got resources, that can help you kind of maybe get back on your toes, and them types of things, and the counselors and their therapists out there are all amazing people. There's I don't know, maybe Shay can respond to some of these questions that I can answer, as far as help with the opiates, and then after
Mhm.
getting the help with other things that they can help with.
So, would you say that you were one that had a little resistance, or you've heard a lot of the stigma sometimes that some of these programs can
Well,
be? I mean, basically, how did you get past the denial to saying, "Oh my gosh"? Well, obviously, a lot of the hospital stuff. I mean, your heart and everything else
Oh,
you're talking about. That obviously will wake a person up.
yeah. Well, I'm still, I gotta next week go get another stress test. I've been kind of having some problems there, since all this, but uh, it's it's hard. It's a tough road, but
Hmm.
with the methadone and that type of stuff, it helped with probably 80% of my issues, whether it was the cravings or the other mental aspects of it. The people to talk to, and it's always better to talk with someone about it that's experienced or been in that situation. Or
Hmm. Hmm.
I don't know if I'm answering all your questions, but
Well, it's all important. I mean, because the whole idea for this is that somebody out there that either themselves or they know somebody that needs to get help. We've talked before we went on the air here. We talked about self reliance. A lot of people think they can just, because I was one of those guys. I always said, well, I got myself into this. I'll get myself out. I'll do it my way. Then they realize, well, I realized nope, I can't do that. It's okay to ask for help, and they got to get out there. And
yeah.
I think I don't know, Shay, is that where a lot of the stigma or the resistance comes from? Is maybe some of that self reliance?
Yeah, I think it's different. Like you've talked about, really depending on each individual. I think there is a lot of stigma around getting treatment, and a lot of people, even when they talk about coming in to get methadone treatment, is people will ask me frequently, well, how long do people have to be on it, and is this just another opioid? Are we replacing it with just another addiction? And
Yeah.
I think to me, the interesting thing is we don't ask those questions for people who have other like medical illnesses. For example, if someone has diabetes, like type 2 diabetes is part genetic and it's part lifestyle choice, which is very similar to addiction. It's partly genetic and it's part decisions people have made in their lives. But when people start, say, insulin for diabetes, we're not typically saying, well, how long until you lose weight, start diet exercising, and when are you going to get off your insulin? When are you going to get off that? Or with high blood pressure, when are you going to get off those meds? And so similarly with methadone, I think it's a medication that helps people stay stable for a long period of time. But because of the stigma that comes with addiction, people are kind of quick to wonder how long people have to be on this medication and how long until people can be done with treatment. And I would say for a lot of people, and Delane, brought this up for himself, that it's something that helps people stay well for a long period of time. And so
Mhm.
I do think stigma is a part of why people don't get treatment or feel like this obligation to get off as soon as possible. But I that's just not evidence based, and I think it's unfortunate that people who are already struggling have to deal with that additional stigma too.
I think with opioids, it's a love hate relationship.
Hmm.
You can hate medication all you want to, but we need it to help us get through, right? But it's also you got to know how to take it and how much to take,
Yeah.
and that's why a prescription is always the best thing to do, and the doctor is going to hopefully take care of you and say, this is all you can have and all that. But I mean, it's just I don't know. You kind of wonder where we'd be without medication, I guess. But we're not, 300 years ago. you know, it is what it is, and
And
there probably was addictions back then, even many, many, decades and years ago and centuries ago, where people
yeah.
got addicted to different things as well. But I mean, this is great, Delane, that you are coming forward and telling everyone around the area, what you went through. What would you say to someone? I guess if someone came up to you on the street, I know you have a dealership, people coming up, walking into your door and saying, "I need help." What do you say to them?
What would I do?
Yeah.
Um, I would probably sit them down, talk to them, see if I could encourage them to possibly get some help. Maybe tell them my story, and
Hmm.
maybe try to encourage them to go to the hospital or to Prairie Ridge, and maybe try to help them get to that point, whether it be the hospital or Prairie Ridge, and maybe try to stay in contact with them, try to be a friend, or
Hmm. Don't you find, Shay, when you talk to patients that come out, that they just don't think they have an issue on some cases?
Yeah, I think a lot of times by the time people come through our doors, oftentimes they're there because they're wanting to get help, and so I do think that's part of the benefit that we have is that by the time they come to us, they're motivated and they're ready. There are times that people come to us because they're there involuntarily for court-ordered reasons or from committal reasons, and that's when we're working with people to try to find that internal motivation and try to figure out, what about your life is not going well, and what about sobriety could make your life go better than it's going right now? Because if there's some reason that the courts are making you be here, let's try to figure out what that is and why and how we can move forward past that. But we do have quite a few people who come in our doors who have. I'm always just sort of blown away by the amount of things people have gone through in their lives, the amount of trauma, the things that they've had to face. And, most people don't wake up one day and say, I want to be addicted. They usually start using substances because they're trying to escape or avoid something that's really tough in their lives. And so when we're trying to have people stop using substances, the other part of the conversation is what's it going to be like to live your life sober? Because for a lot of people, that means facing things that were really hard for them before they started using. And so that's where, this holistic approach where we use medications in addition to therapy, I think is really helpful, that we're really looking at that individual's experience and what we can do to support them in their recovery.
Well, support is so important, and I can encourage family members out there, please, please, please understand what I'm about to say. Do not hate the addict, hate the addiction, because what this is all about are issues inside. Okay, it's just it's just the symptom of what's wrong with you. Okay, there's a reason why you're thinking the way you're thinking to get to the point of well, I don't know, Delane, did you feel like I would say that you probably felt like you hit your bottom right there.
Yeah, I was, I was close to a couple things of doing, and by the grace of God, saving me.
Yeah.
I wouldn't be here today. And
let me tell you something encouraging that I learned, being 20 years in recovery myself is.
That's awesome. You're the man, Harry.
I think even the Bible talks about you got to lose your life to get it back.
Yeah.
And, we're just glad you're here, Delane. I mean, and can talk about it and share it with people, share your story. It's important that everybody does that. But first, if anybody listening needs help, go to prairieridge.net if you want some more information on this program. Obviously, lots of different programs that they have out there, but this is a big one, opioid treatment program through the North Iowa Addiction Prevention Alliance. When did that start, Shay? When did you guys start that alliance?
The Alliance is a community-based organization, and I don't know as much about that, so I'm not sure when that started, but we're sort of supporting it and part of that.
Yeah.
Did you know, Harry, I was the very first patient.
You were?
Yeah.
Oh, you mean for the opioid program?
Yeah. Okay. So,
all right.
I guess they kind of made me their model patient. I don't know if that's such a good thing or not, but.
Can you
we asked him and he consented. I'll say that.
Right. Hey, can you get us in the right direction when we go online and go to prairieridge.net? I don't care if it's a family member doing this or people that feel like they're addicted, they need the help or whatever. Can you kind of maneuver? Is it real easy to find more about this program?
Yeah, so if you go on our website, you'll pretty easily find it in one of our drop downs where we talk about all of the different options for opioid treatment. And I would say for anybody who's interested, you can always call or just stop in. We have always front desk staff there to help. And so for anybody who has questions or family members, if you're not understanding something you're reading, you can always give us a call and we can walk people through it. Sometimes it's helpful to understand, what's this person going through right now and where might our services best align with them. And we have walk-in processes every day of the week except for Fridays where people can walk in at certain times of the day and we're able to get people plugged into the right treatment. So we just do an overall assessment and then see what that person might need and then help guide them in the right place. So there's really no wrong door. Happy to answer questions and happy to help people find what they need.
Anything more you'd like to add here to our discussion today?
I would just add that methadone it's a medication that really does save lives. It does really reduce the risk of people returning and relapsing. The thing that's really difficult with opioids, like Delane mentioned, is that when people try to stop using opioids, they're usually nauseous, vomiting, have really bad stomach aches, sweating, feel irritable, anxious. It's really uncomfortable. And when people try to do that on their own and just stop, those symptoms can persist for days to weeks. And so that's when we see a lot of people who are really well-intentioned trying to stop, that then return to use because they're just so sick. And so the nice thing with this medication is it lets people stay level. It doesn't, people who have been using opioids don't get high when they use it. It just allows them to stay in a nice steady place. So then they're able to start, utilizing the other resources. And then over time, they can gradually taper off this medicine without having to feel so sick. And so it just gives people kind of a landing spot so they don't have to keep returning to use just to feel normal. That's what a lot of people tell me is they keep going back to it because they just feel so sick or they can't feel normal without it. So this medication gives people that opportunity.
Well, I hope everybody understands there is an answer to this. I hate to use the word cure, but it's definitely a good answer to try anyway to change your life. And that's what you got to do. You got to want to change your life and turn it around, which is exactly what Delane has been doing here for 4 months now. So, Doctor, thank you so much for your time today. And Delane, I just got to tell you, brother, one day at a time, man. Right?
That's all we can do, Harry.
All we got. It's all
That's
we got.
right.
So let's keep it going here, okay? It'd be fun to talk to you soon, get an update from you.
Yeah,
And,
no problem.
that's what brothers do in recovery. Congratulations
sure.
so far, okay?
Yeah, thanks.
Just keep it going.
Congratulations to you
Thank
on
you.
20 years, my friend.
That's right. Couple of months yet, but yeah.
Oh,
You know what I do? I just drink a lot of iced tea.
yeah.
I love
Heck
that.
yeah. Right.
I love that. All right. Well, thanks, guys,
All
for
right.
joining us here. PrairieRidge.net will tell you everything you need to know about the program. And hey, go get help. Just give yourself a chance, will you? You
Yeah.
can change. I was one of those guys that never said, oh, gosh, I can't. I got to be the way I am. Kind of like your addictive personality type thing, but you can change. And then it's amazing the different things you see and feel when you are in recovery and you're sober. So thanks, guys. Appreciate it much.
Thank you so much. I
Yeah.
appreciate it.
Thank you,
bet.
guys.
All right.